We are here with Dr. Fink-Freeman, optometrist in Greencastle, Pennsylvania, to talk about pickleball player eye injuries, what she's seen in the community among her patients, and what she recommends for prevention.
Thank you for having me.
Thank you for being on.
Yeah, thank you so much.
You're welcome.
And before we jump into all the different levels of eye protection that you can get and different routes that you can go, we did want to have a special shout out to Kitchen Blockers for bringing this episode to you. So if you would like to get a pair of Kitchen Blockers, you can use the code. These are not mine. The pink ones are not mine. You can use the code PICKLEBOX for 10% off at kitchenblockers.com. We will link that below and also give the promo link in the video and description. So,
and these are what we actually wear to play.
Yes. So we both wear Kitchen Blockers. And before we jump into what you have on the table, we would love to get your take on these themselves, just from your standpoint. Obviously a little different, seeing that they don't have lenses.
Right, yeah, that's what struck me at first, but I totally understand because I have seen the pickleball too, that it's not going to fit through here. So yeah, we should give you protection from any eye injuries at all. I know in the day when everybody was playing racquetball, that was the concern, is that the ball would give and actually literally fit right into the socket. So yeah, I could see that would definitely work real well, and also you wouldn't have to worry about fog. I think we've chatted about that too. But yeah, I think looks like a great way to avoid eye injury.
Yeah, it's definitely something that we had heard off and on about different individuals across the country maybe getting a ball to the eye, and it's a freak accident.
Right.
And we were at a tournament where Sarah caught a ball a little too close to the eye, which was what started our concern about it. And then you caught a ricochet.
Yeah, just about a month ago. It wasn't me being slow. It wasn't an opponent aiming for my face. My partner semi-missed the ball. It ricocheted off his paddle, hit me. I looked back to see where the ball was going to go. It hit me square in my eye. I had zero eye protection.
I have heard that story before.
It was horrible.
Yeah, the ricochet.
I felt like I wanted to faint and vomit. I cried in public, which I don't do.
It was not great.
The most horrible pain, and it was so scary because it hit right in my eye. And then that night, John and I went home and researched eye protection because it was obviously apparent that something
had to change.
It had to change, and I was so fortunate. It was scary.
Did you
what
have
happened.
that checked?
Did I have my eye checked?
Yeah. Did you go
I
to a
didn't,
professional? Oh,
but
okay,
I actually didn't even have a black eye or a cut or bruising.
You got very lucky.
Yeah.
Very lucky.
I can't even imagine how lucky I was. So John came upon this company and we ordered them right away. I wasn't used to wearing sunglasses or anything, so I didn't want to have anything that would be too cumbersome or bulky, and I didn't want to have anything with the glare or fogginess because I'm not used to that. And these are made by a company for pickleball. So it's the right size for a pickleball, and it comes out wide so you don't lose any peripheral vision ability, and they're super comfortable.
Oh, good.
Yeah.
That makes a big difference. And yeah, I mean, in order to get protection, you have to have something that's comfortable that you're going to wear.
Exactly.
Yeah, right.
Yeah. You're not protected if you won't wear it.
Exactly, yes. And if it's going to fog up in the middle of the game and you're going to throw them off, that's not going to help you either. So, yeah, I think that's great.
And they come in cool colors. I got pink, John got black, and
nice.
now we wear them.
Yeah, good.
Yeah, and we try and promote wearing them just to prevent eye injuries because it was very scary, and I know how lucky I am.
Yes. Eye safety is very important on the court, yes.
Yes, yeah, and with the way that the paddles are going, so years ago, you didn't hear near as much about eye injury. Now, granted, there was a lot less players. The sport hadn't exploded like it has now.
Right.
So, you might hear the occasional one-off, and nobody ever tries to go for your face or anything like that.
Sure.
Or they shouldn't be. But the way the paddle technology has just exploded, especially I'd say over the past year
even just in the last year, even a mid-level player can hit a rocket of a shot because of the paddle technology being so advanced.
Do you know how fast? I read somewhere it can go up to 40 miles an hour. I mean, is that...
Oh,
I mean,
would
is
say
it even
absolutely.
higher than that with the
I think
really
it could.
high-level
I would
players?
think so.
Yeah.
Yeah, I mean, you get hit in the
Yeah.
eye with that could be devastating.
Yeah.
Yeah.
Yeah, and especially the thing with Sarah's almost a catastrophic injury is we're playing at a very high level, and what ended up happening was it was an overhead smash that came down, and the individual put a paddle out to get to the ball just as like a Hail Mary, and made contact with the ricochet. So Sarah's looking back to see if
okay.
that ball is going to go back over the net, automatically right into the eye, and they're not even
Right.
swinging through. So it's just the power coming off that overhead smash
Right.
ricochets off the paddle.
Right.
So it's definitely something that we have been pushing more and more. Obviously, if somebody's wearing just glasses in general, just prescription glasses, that's
Or sunglasses,
Yeah.
just something.
Right.
Yeah.
That's going to give you some help, but yeah,
Right.
have an actual safety glass is even better. Yeah.
So we'd love to hear about what you've seen among your patients and also what you recommend.
Sure. Yeah. I mean, when you talk about pickleball or really any sport and an eye injury, I mean, going from front to back of the eye, that's kind of the way that we think. First of all, you could end up breaking the bone around your eye, having an orbital, what we call an orbital fracture. There's a little bone that keeps the eye where it's supposed to be. If that's broken, then all of a sudden your eye can shift, and now instead of your eyes pointing the same direction, one is higher than the other, and now you're seeing double. That sometimes does not heal on its own. Now you're talking about a surgery to fix that.
Wow.
Maybe double vision, for the rest of your life, unless the surgeon, can actually fix that so that everything is literally lined up the way that it was. So that's one of the worst things that could possibly happen. I've seen people just get what we call it on top of the white of the eye, there's the conjunctiva. There are blood vessels in there. Those blood vessels can burst. I have a friend of mine who plays in Michigan. She sent me a picture of herself with a broken blood vessel because she got hit in the eye, and that's not that big of a deal, really. It looks worse than it is. Right. Corneal abrasion, the cornea is the very front surface of the eye that's real sensitive. That can happen. Again, these things are going to heal up pretty quickly. These two things, the cornea and the conjunctiva, are going to heal up pretty quickly. I did recently see over the last month a gentleman that got hit very hard, and it was a ricochet, just like you. And what I think about, and maybe I'm wrong on this, but if you're getting something, a ricochet, it's going to be traveling a little less fast than if it were a direct hit. So, you figure if you got direct hit, that would be even worse. But this gentleman got a ricochet too. And can I show you some pictures?
We'd
Yeah,
love
absolutely.
to see them.
I don't know how well this is going to show up.
We'll do
but
some after this. I'll get some actual B-roll of it so that everybody can get a really good glance into what eye injury off of a pickleball can look like.
So, like I said, this particular gentleman that got hit in the eye couldn't even see. Like, if you're familiar with having your eyes checked, couldn't see the big E. If you can't see the big E, that's bad. So in the one eye, couldn't see the big E. So we took a picture. This was his good eye. This is the retina, and we can see that. You want me to show them that?
Sure.
Yeah. This is what it looks like. Orange is good. You want to see orange. This is the other eye, and really, you can't see much, right? That's what his eye looked like, the inside of his eye. You can't see anything because there's so much inflammation in his eye. That's why he couldn't see. If I can't see to the back of your eye, you can't see out either. So this was his eye on day one. Somehow he really got better rather quickly. This is the second day he did get a lot better. Okay. The inflammation did go away, but that's treated with eye drops. And the big concern when you're getting hit this hard, especially when you're looking at this, is what's behind there. Did you end up with a retinal tear or a retinal detachment? Because that's the worst case scenario. And I do have, this is a picture of what a retinal detachment does look like. This is not a pickleball injury, but I just wanted to let you know what that's what a retinal detachment would look like. But something like that could absolutely happen. This gentleman was very lucky that it didn't happen to him. But yeah, if you get hit hard enough, the whole eye, just the vibration itself can cause a tear. The tear would cause a detachment. And again, you're looking at a surgery. And this gentleman was probably out for 2 or 3 weeks, just healing. You have to take eye drops that make your pupil real big. You can't see real well. So that was probably the worst one that I personally have seen, although, like I said, definitely it could could be worse. You could end up with a retinal tear or detachment and inflammation within the eye, which, when you have a injury like that, now you're at lifelong risk of developing a disease called glaucoma. Anytime you have a bad injury, so you have to be on alert for that really the rest of your life.
That was going to be my follow-up question to that, is what if, so you heal from this, but now the long-term effects, you're going to have to be on guard for the rest of your life.
Right. Could cause cataract too, sooner rather than later. Somebody who's younger, who may not get a cataract till they're, 65 or 70, might get it in their 40s or 50s or, a year or two after they've had the injury. So that happens.
Is that just from so that's the swelling of the eye, putting pressure?
Right. Okay. Inflammation, yes.
The inflammation. And then are we also worried about scar tissue within?
Yeah, depending on exactly what happens to the eye. Yeah, you can end up being scarred. But this gentleman actually, like I said, was real lucky and didn't have anything permanent. But again, we have to keep watching him, make sure he's not developing glaucoma.
Right.
That's the main thing for an injury like that. But yeah, you live and learn. And now, last time I saw him, he said he was wearing safety protection on the court now. Yeah.
So what types do you have here at your office that you recommend for athletes?
Yeah, we have both prescription and non-prescription, because some people, they can't. Some people don't wear contacts.
Right.
Some people can't see without protection. So we do have ones that these are sports safety glasses. You can put a prescription lens in this.
That's great.
Somebody, we could order that in their actual prescription. If they wanted it as a sunglass, if they play outdoors a lot, we could do that. We actually work with a lab that has new lenses. Maybe you guys have heard about these. They have new pickleball lenses called Color Boost lenses that are actually help increase contrast, decrease glare. Yeah, and they come in different colors that are recommended.
Wow.
So we could do that, or we could do totally clear also. But yeah, some, and they're different sizes for different people. But yeah, definitely can go prescription. We also have the non-prescription ones too. We have sunglasses and regular, and really it just needs to be a impact resistant lens, polycarbonate lens. If you're going to have a lens, which I know you guys don't, but yeah, if you're going to have a lens, it has to be impact resistant. That's why, we wouldn't really recommend just regular glasses. I will tell you, nowadays, most glasses are polycarbonate. Like the glasses I'm wearing, they're polycarbonate because it's a thin lens, and a lot of places just, you're wearing your street glasses, they're polycarbonate, which is the most impact resistant lens. That's going to be the same thing you're going to have in a safety sports lens too. But then the frame is made also to be protective also. Yeah.
Right.
Yeah. So, like if I would wear these, sure, they're going to give me more protection. But if I was going to wear a safety, that's going to give me more protection than these.
Now, I've heard some players in pickleball use just cheap sunglasses and then punch out the lenses. Does that provide enough protection, do you think?
I would say no to that.
Okay.
Yeah, especially if they're cheap. I mean, I truly believe you get what you pay for in life. And especially if it's not made to be a safe, a sports safety glass, I wouldn't recommend that.
Okay.
Yeah. Again, it might give you more protection than nothing, but
right.
Yeah. I would probably, if you wanted to do the no lens, I would lean towards your the type that you guys have here.
Okay.
When I would assume too, if you're going with the cheaper sunglasses, you have there's no background on what the plastic. They can kind of say whatever it is. So even if it does protect from the ball actually hitting, if it shatters, now you get a shard of plastic in your eye.
Exactly.
And now you might not have taken a direct hit, but now you've got plastic rolling around inside your eyeball, which is not great.
Yes. Yeah. Using something specifically made. And I love the fact that those are made specifically for pickleball.
Yeah, we were so happily surprised when we came across these that they're literally made by a pickleball company.
Yeah, interesting.
So they look at the dimensions of a pickleball as well as the velocity of hitting the ball.
Right. Okay.
Yeah.
Oh, and I see that you can have a strap on them too.
Yeah.
Okay.
So you
That's
can.
nice.
Yeah. So they come with the option of strap or no strap.
John took his off. I keep mine on.
Yeah. Okay. So you can go either way.
And they're light and comfortable.
Right.
Yeah. I prefer not to have anything riding on the back of my head, and without it, it fits fine. Sarah doesn't mind the strap, and it works perfectly for her.
Right.
And honestly, I'm probably the last person that a few years ago you'd have told me that I'd be wearing eye protection on the court, I'd have laughed at you.
Yeah, is that right?
I'm the idiot who snowboards without a helmet sometimes when they definitely should be. I never, you're like, it won't happen to me. I'm quick enough to get out of the way.
Right.
But it really is the freak accidents that are the ones
That's exactly
I'm
right.
hearing about more and more,
Yeah,
and
the
then
ricochet,
seeing it. Exactly.
that type of thing.
Yeah.
And it doesn't matter how fast you are. When
Right.
when a paddle is here and your face is there, you're not moving.
Right.
You just don't know.
Yeah, and it's such a fast sport, and you are so close to each other that if you're hitting a very hard ball at somebody, 15 feet away,
Yeah.
yeah, that could be devastating.
Plus, like we said, with the paddles getting so powerful, the equipment themselves,
yes, just like
they
any
are
other
getting more
sport.
powerful.
Right.
Plus the players, like this was a group of young, powerful guys. It just,
Right.
I can't even believe how lucky I was.
Yes.
And I was really hesitant to ever have eyewear. Like I had seen on Facebook people that I don't know, just in other states with eye injuries. And I don't wear a hat or a visor or sunglasses or glasses. So I was like, there's no way I'm going to wear anything on my head. It'll distract me.
Right.
But something like this, it really can be comfortable.
Right.
And now I don't play without them.
And that's the thing. It has to be comfortable or you won't wear it.
Right.
You have to, you have to get used to it, and it has to be something that you'll wear.
I will definitely wear them.
Yeah, if it's uncomfortable and you don't like it, you're not going to wear it. You might try it a couple times, but
Yeah, but like John said, like I never thought I would wear anything. John's reason is different. He will take on risks. My reason was I just didn't think it'd be comfortable to wear anything.
Right.
And now both of us wear them and they're comfortable
Yeah.
and important.
Well, and even like years ago when I first started playing, I've been playing on and off since 2019. The paddles weren't near as hot. I mean,
Okay.
at all. Like,
So it has made a difference.
it's made a huge difference.
Even in the
Wow.
last year.
Is
Yeah.
that right?
I mean, like the old paddles that I have from Head at the time were like, that was the power paddle, and if you went out and hit with that and like a cheap power paddle now, you'd be like, this is plywood, the old ones. And most people weren't even trying to get to overheads. There wasn't like,
It was a softer touch
Yeah.
game.
yeah.
And now there's a lot more power shots.
I see.
So
Okay.
just based off of the way that the paddles themselves are changing, I think the eye protection has to come in with it now.
Yes,
It has to go hand in hand. And unfortunately, I wouldn't say for the most part, and again, no one's like out to hurt people, but what you're seeing now is these power paddles coming in and really low-level players buying these power paddles because if I get what I pay for, right?
Right.
And so then they go, well, I'll buy this $300 power paddle, and now I'm going to play like a 4.5 to a 5.0.
Right. Okay.
And they'll just rip shots that they have no business ripping, or
And
an
they can't
overhead.
aim it correctly.
Right. An overhead that you don't know where it's going. Right. What should be at your feet might be right at your head.
Okay.
So that's definitely another
that
reason
does
to
increase the risk then. Okay.
Correct.
Yeah.
Yeah.
Plus, like you mentioned, everyone is so close.
Yes.
It's a small court.
Exactly. Yes.
And then from another pickleball standpoint, I have seen a drastic shift in Sarah's game by wearing these because she feels more comfortable at the non-volley zone.
Yeah, my fear has
That's
subsided.
good.
So I
Yes.
stay right in there,
Yeah,
ready. Like,
okay.
what do you have?
Right. Okay. Because you're
'cause
protected. Yes.
Naturally, you might recoil seeing your opponent with a ball that I might have popped up,
Right.
but now I don't have that fear.
Okay.
So I'm willing to
that
stay
makes
right
a
in
lot
there
of
and
sense. So
continue the point.
wearing the safety eyewear has made your game better.
Yeah, it gave me more
Yeah,
confidence
yeah.
and
Oh,
has
good.
improved my hands at the net. So
Let me ask you this. So, because I've never read this, can you give me an estimate? What's the average number of people that are wearing safety eyewear? Do you?
ooh, it's not high
it
enough.
pretty
No,
low?
I
Is it pretty
think,
low?
yeah, I think that this. So just for like, not from a number standpoint, Kitchen Blockers on Instagram, I think has like 900 and like high 900 followers, right?
Okay,
They're a
okay.
brand new company.
Okay.
I think that what you're seeing is a bigger push in eye protection now that the paddles are getting hotter.
Okay.
So just this year, I mean, they just came out a few weeks ago with another list of banned paddles, right? That are playing too hot.
Really?
Yeah.
Is that
So the
right?
RPMs are too high, the velocity's too high.
Wow.
So
I didn't
they
know this was
are.
going
Yeah, and you're not
on.
Oh,
allowed
yeah,
to use them
yeah.
in tournaments.
Wow.
Yeah.
Okay.
But you could still use them in rec play.
So tournaments do they have any rules that you
They
have
do
to wear
not.
No, they
eyewear?
don't.
They
really don't.
Interesting.
They do not.
Okay.
The only rules they have are about your paddle itself, not about protection.
Okay.
So
So you
from-
could wear it or not. Then.
Yeah.
Okay.
So from the paddle
okay.
manufacturer standpoint, there are guidelines that they have to follow for USA Pickleball approved paddles to play in tournaments.
Okay.
I think you're going to see a lot more eye protection come into this
Sure.
as the sport, again, as these paddles get hotter and hotter, they can only regulate them so much.
Right. Yes.
And so I would say I've seen a lot more people wearing eye protection in probably the past 6 months than before.
I agree. But
Is that
even
right?
out of
Okay.
an entire group of people coming together to
it's not
play,
enough.
you might see 1 or 2 players
Is
out of the
that
entire
right?
group
Okay.
with eye protection.
Interesting.
It's not common yet.
Yeah.
So we're really trying to get the word out.
Yeah. So I feel like maybe like somebody knows your situation, that you got hit in the eye. Okay, well, she got hit in the eye. Maybe I should get safety glasses too. So maybe, as the word gets out, people will realize that it is very important. I remember, like I said, going back to the day when people played racquetball, like I felt like everybody wore eye protection for racquetball,
Yes.
Which makes sense.
Yeah, and it's the same sort of thing. It's a fastball coming at you, and it's hard, So, I mean, if you get hit in the eye, that's not going to be, it could end up being not a good thing.
Right.
Yeah.
My mother was still is, but her sport was racquetball. Loved racquetball.
Is that right?
And as a
Okay.
child, I always, in her bag was her goggles and her racket
yes,
and some balls, right?
yes.
That was it. The goggles went with her everywhere. You always wore them because you heard
Automatic.
horror stories
Right.
of someone turning to see where the ball's at, taking a ball straight to the eye, and they're black and blue for weeks.
Right.
And that was a lucky,
Right,
a lucky hit.
Right.
So I really do hope that there's some pros. I think it's Zane Ford. I'll have to go back and double check. He's a young up and comer in the pro scene. He pushes the kitchen blockers a lot. He's wearing them at every tournament, even in singles.
Do most of them wear protection?
I would say
eye
most
protection?
of them don't.
No.
Is that right?
It is
That's
still
interesting.
really uncommon
Okay.
to see
Wow.
them.
Yeah.
Unfortunately.
Yeah.
But I do, again, it goes back to what the sport used to be and what it's becoming.
Right.
When
I had no idea that the paddles were getting
that
much better.
And I mean, even years ago in 2019, when I started playing, my poor mother had bugged me for years before that to play. I said, I don't play an old person sport because it was branded as, like the retirement home, like they were out with these finesse shots.
It was, a soft game.
Yeah.
Right, sure.
And like a lot of the younger guys who started to come out, we started to drive a lot more balls. And the entire, the culture around it was not to do that. Right. Don't drive the ball. That's not what you do. That's not the culture.
Okay.
And I know, I can, just thinking about this, there's faces and names that pop up that would give us a lot of garbage for the way we hit the ball.
Is that right?
Even if it was a winner. That's not how you do it. That's not the culture.
They didn't want you to hit hard.
And the entire game has shifted drastically as the paddles have gotten hotter, as younger individuals have come into the sport.
And from other sports where they've developed their power and they're still young and athletic, and they're bringing all of that talent into pickleball.
Okay, interesting.
Like a D1, a former D1 tennis player who's just getting off of the D1 college career, is picking up a paddle. And they can rip the ball, like there's no tomorrow. And with Sarah playing senior pro, we'll sit around and watch the 20-some-year-old guys play singles, and it's insane. It's actually as athletic as I am.
Powerful.
The first time we watched it, I was like, I'm not playing that. It's like I don't even want to at this point.
Yeah, to see it in person.
So the game has just shifted.
It has shifted drastically. It really has.
So
safety is important.
So I appreciate that you guys are bringing this to the forefront.
We're trying.
Yeah, because I would rather sell somebody a pair of safety eyewear than see them once a week for a whole month to get their eye better. Yeah, because if you end up with especially a retinal detachment, that's a big problem. But you may not recover from. So you may not be playing pickleball. At least not at the level you're used to again,
Right.
Well, and that's probably the scariest thing for any athlete of any caliber is any time that you do have an injury, whether it's a muscle tear, tear your Achilles, you pull a hamstring, you get an eye injury, all of a sudden you're just stepping back on what level you were playing at, what you can play at, and then the longevity of your athletic career.
Right.
Which is,
exactly.
you know, I mean, I know for both of us that's petrifying to think that, you know, maybe, you know, I didn't even think of like the long-term effects till just now, and like a cataract, you know, I sure don't want to deal with a cataract at 50 because I took a ball to the eye at 35.
Right,
Right.
exactly. Yes. Yeah. Or even.
Is there anything else besides physical protection that people can do to have healthier eyes for their sports? Like any type of nutrition or any other self-care?
Yeah, I mean, absolutely. Well, when outdoors, we do recommend sunglasses.
Okay.
UV light is not good for the eyes. I know you guys are probably playing those outdoors, but yeah, that's the recommendation. UV light, just like it's not good for your skin, also can cause cataracts, macular degeneration over time too. There are some good eye vitamins on the market that are good. Certainly, eating green leafy vegetables are really good for the eyes. Kale, things like that. So yeah, just good nutrition is really good. Yeah, main thing I tell people, good nutrition, and also have your eyes checked on a regular basis. That's certainly a good thing. And then sunglasses. Those are probably the 3 best things that you can do for your eyes. Yeah. And really, as an eye doctor, I really do think having your eyes checked every year is a really good idea. Because you just never know. I mean, I saw a gentleman just last week who hadn't ever had his eyes checked, and I saw some things in his eyes that he would not have known were there, and it's something we need to watch. It's not giving a problem now. He's younger, but 20 years from now might give you a problem, and if we know about it now, we could maybe stop that from happening. So prevention. Right, exactly. And if you want to continue playing your sport as you get older, you want to have as good a vision as you can.
Absolutely.
Whether it's glasses, contacts, or just healthy eyes. Yeah.
Right.
Yep. So yeah, that was a good point too. That just taking care of your eyes too. Yeah.
Yes, we really try to look at everything from a holistic standpoint of training. I mean, it's not just you can train very hard and still be unhealthy.
Right. Exactly.
We probably drink way too much caffeine.
Yeah.
Alone, but because of the training. But if you're being proactive on safety and what you're putting into your body, right. I don't want to speak for both of us, but I would say we both have the standpoint that we want to see how much we can get out of our body. Like that's the end goal is to kind of see how far you can push the engine.
Right, sure.
And so we try to do these little micro tweaks along the way to see what helps and what doesn't. So I never thought of, the eye as being something to bring into that equation.
Yeah, we had not thought about eye health until a few weeks ago.
Yeah, and again, I mean, it's one of those things we take for granted. You know?
I know.
Yeah, we get up, we can see, we're good.
Yeah, it's very bizarre that's not something that's at the forefront of our thought process.
Yeah, exactly.
I mean, you wake up, you open your eyes, okay, you go about your day.
Yeah, right.
Where, especially if you're out training and doing other things, you're looking at physique and weight and all this, and you're looking at it with your eyes.
Right, exactly. That's something to think. Yeah. I mean, you wouldn't be able to play pickleball if you can't see.
Right.
Exactly.
Yeah. So, yeah.
Awesome.
Well, thank you so much.
Yeah.
We really appreciate your meeting with us.
Thank you both. Yeah, it was a nice conversation. I enjoyed it.
Treating our fellow local pickleball players as well.
Yes, yeah. If anybody ever needs anything, we are here in the community. Been here for 40 years, and hopefully we'll be here another 40 years. Yeah.
That sounds amazing.